Thoracic mobility with a lacrosse ball. You're going to lay on the lacrosse ball and place it in the mid-back. You want the ball to be on the side of the spine, never touching the spine, but on the paraspinal muscles. You can start anywhere in your thoracic spine where you start to feel a little bit of the rounding in your back. Lay on the lacrosse ball and then take your arm overhead with a straight arm and then karate chop it across the opposite side of the hip. You'll feel a little bit of crunching if you've got some scar tissue or some really unhappy muscle tissue in the back. What you're going to do is repeat this motion over and over, and we're going to use that to help break up that muscle tissue. After you've done it a few times in one area, you're going to roll down on the ball about an inch or two and repeat until you find those muscle tissues that need more attention. When you get higher up in the back into the levator and the trap area, you can lift your hips and then repeat the same motion. This is kind of the area that you get massaged if someone's seated behind you, rubbing your shoulders. The levator is what's at the top of your shoulder blade, and the trap is the muscle that comes down from your neck. So we're going to use the ball in there, break up that tissue, and what it will help do is to relax the shoulder blade and drop it down a little bit. I recommend doing one side at a time. After completing one side, lay flat on your back and just feel the difference between the tissue from the left to the right. You'll notice the side that you rolled is a lot flatter and will feel healthier. After completing the one side, go ahead and go into the other side.